Unveiling the unique signs of autism spectrum disorder in girls, insights from psychological research. Girls with autism spectrum disorder, ASD, often exhibit different signs and symptoms compared to boys. The presentation of ASD can vary significantly among individuals, making it challenging to generalize the signs across all girls. However, research suggests certain patterns and characteristics that may be more commonly observed in girls on the autism spectrum. It's important to note that these observations are based on available research up until September 2021, and new findings may emerge in the future. Social interaction and communication. Difficulty with social communication. Girls with ASD may struggle with social interactions and communication, but they often develop more sophisticated compensatory strategies than boys. They might engage in masking or camouflaging their social difficulties by imitating peers or learning social scripts, which can make it harder to recognize their challenges. Social isolation. Girls on the autism spectrum may find it difficult to form and maintain friendships. They may prefer solitary play or exhibit more passive social behaviors, such as observing others from a distance or engaging in parallel play rather than interactive play. Chameleonic behavior. Girls with ASD might have a strong desire to fit in and adapt their behavior and interests to match those of their peers, which can make it harder to identify their social difficulties. This ability to mimic social behaviors can often lead to delayed or misdiagnoses. Sensory sensitivities. Like boys with ASD, girls on the autism spectrum can experience sensory sensitivities. However, they may be more likely to internalize their sensory difficulties, leading to coping mechanisms that may be less noticeable. For example, they might develop strategies to manage sensory overload in social situations without drawing attention to themselves. Preference for imaginative play. Some girls with ASD may engage in repetitive or imaginative play that involves sensory stimulation, such as spinning objects, visual stimming, or fascination with certain textures. This can be an avenue for self-regulation and a way to manage sensory sensitivities. Restricted and repetitive behaviors. Special interests. Girls on the autism spectrum might have intense interests in specific topics or activities. However, their special interests may differ from those typically seen in boys. While boys often gravitate towards objects or systems, girls may develop interests related to animals, literature, art, or fictional characters. Social imagination. Girls with ASD may demonstrate challenges with social imagination and pretend play, but these difficulties can be more nuanced compared to boys. They may exhibit difficulties understanding and engaging in imaginative scenarios or pretend play involving social roles and interactions. Repetitive behaviors and routines. Both boys and girls with ASD can display repetitive behaviors and adherence to routines. However, girls may be more likely to develop less obvious repetitive behaviors that can be mistaken for typical behaviors. For instance, they might engage in repetitive self-soothing gestures or rituals that are not readily noticeable to others. Masking and diagnosis challenges. Masking or camouflaging. Girls with ASD may be more skilled at camouflaging their difficulties in social situations. They might actively mimic the behaviors and mannerisms of their peers, making it harder to identify their social communication challenges. This masking can lead to delayed or misdiagnoses, as the girls may appear more socially adept on the surface. Diagnostic overshadowing. Girls on the autism spectrum may receive a delayed diagnosis or be misdiagnosed with other conditions. This is partly due to the assumption that ASD primarily affects boys and the diagnostic criteria being based on male presentations. Clinicians and educators should be aware of these biases and ensure comprehensive assessments to accurately identify autism in girls. It's crucial to remember that these signs and characteristics are not exhaustive or definitive. Autism is a spectrum disorder, and each individual's experience is unique. Girls with ASD can display a wide range of strengths and challenges, and their symptoms may overlap with other conditions, making accurate diagnosis and support crucial. Ongoing research and increased awareness will further our understanding of autism in girls, enabling earlier identification and intervention.